Well, thank you very much to our chairman and ranking members for holding this really important hearing today, and I appreciate the testimony from everyone. Mr. Townsend, I want to particularly thank you. Your story was my family's story. My dad was a World War II veteran, diagnosed with MS when I was a young teenager, 7 kids in our family, and our family went through what your family is. So I want to thank you for your service and sacrifice for our country. And I want to thank Lisa for what she, I know, does every single day for your family as well. And tell you that's why I worked so hard to get the Family Caregivers Act passed personally, because I know what so many people struggle with, and it is a real challenge. And as chairman of the Senate Veterans Committee at the time, I worked really hard to implement it to make sure it actually was in line with what our congressional intent was. So this hearing is really important as we evaluate it now, and what all of you have said to us is really important. Mr. Townsend, you answered Senator Casey a little bit, but just tell me, while the VA continues its review now of this program, what do you think we need to particularly focus on?
Particularly with regard to eligibility for the comprehensive program. Once again, I would go back to my previous statement that the VA's current interpretation of the eligibility criteria and requiring assistance with the performance of activities of daily living each time that activity is performed is unrealistic, and as a result excludes a tremendous number of veterans and caregivers from myself from what otherwise is a very, very valuable resource, a very valuable program.
Yeah, I appreciate that. I totally understand that, and that is really helpful. So again, thank you. Thank you for being here and sharing your story and for what your family's done. I want to turn to Ms. Neekins. Did I say it correctly?
Neeskins.
Neeskins. Thank you. Thank you for what you do for your husband and your family and your community and everything, and being a caregiver. And I wanted to really ask you something that doesn't get talked about a lot, and that is the high level of stress and depression from caregivers, who I know it's especially true for post 9/11 caregivers. 40% have met criteria for major depressive disorder. That's actually twice the amount as pre 9/11 caregivers and 4 times the rate than that of non-caregivers. That is really a heartbreaking statistic, and I really think it's something we need to focus on. Can you talk a little bit about what services are currently available for caregivers who need mental health treatment and what we need to do to really address that?
Yes, I agree that that is a startling statistic, and I think, that's the reported statistic, but in my experience, just being in the caregiver community, I think that the rate is actually higher than that. One of the things that I think is so important about the PCAFC is the support it does provide to caregivers. There are community functions where they host abilities for caregivers to actually interact with each other, to meet other caregivers, and that allows caregivers to feel less isolated. Being, a caregiver at a young age, I think is something that most people don't expect. That greatly is in contrast to people who are caring for someone who is geriatric. And we certainly expect people of a certain age to have mobility needs or supervision, protection, and instruction needs. However, to have to care for someone who's in their 20s who has those same needs just is difficult when you're in your 20s yourself.
Correct.
So that certainly is kind of something that the PCAFC does, attempts to do, is to support caregivers in learning how to become a caregiver and to connect with each other, to provide educational resources. There's also outside foundations like Quality of Life and Elizabeth Dole Foundation, who also provide caregiver communities and resources and educational calls and so on and so forth for these caregivers. But ultimately, they're really, I guess, something that Mr. Townsend spoke to was the CHAMP VA benefit that is allowable if you are a caregiver through PCAFC, would be your resource for getting mental health therapy as a caregiver. And if you are just in the program of general care and you do not have 100% permanently and total disabled person, you do not have access to that CHAMP VA or perhaps that insurance that would allow you to seek those mental health therapists.
Thank you. Mr. Chairman, my time's out, but I just want to also mention that something that I personally know well is that 2.3 million children live in a household with a disabled veteran. They provide really unique challenges and responsibilities. And Senator Bozeman and I have a bill called the Helping Heroes Act to help establish a new program to support kids who live with a disabled veteran and give them the support they need. And I hope we all look at that as well. So thank you. Thank you all very much.